Now, then we have to talk about a compound called warfarin. So warfarin is it's a compound, but what it does is that it actually inhibits an enzyme that is important for. Now, without getting too much into chemistry, the thing is that when you have vitamin K and it's doing its activity in the clotting cascade, it actually becomes what we call oxidized, and we will get to oxidation and reduction later on. But I'm putting it on the back burner for now. So, thing is that vitamin K kind of gets used up, but it's not completely destroyed, but it has to be regenerated. And there's this enzyme called vitamin K epoxide reductase, and warfarin inhibits that enzyme. So warfarin kind of inhibits the regeneration of vitamin K in its useful form. So this is warfarin, and what does warfarin essentially do? It basically blocks the activation of all of these, or of all the vitamin K dependent clotting factors by preventing the regeneration of vitamin K. So yeah, so what we have here, vitamin or warfarin is basically putting the brakes on all these coagulation factors in the coagulation cascade. By blocking all of the activation of all of these coagulation factors, this is going to prevent the activation of factor X and then also thrombin and the conversion of fibrinogen into fibrin, thereby preventing the coagulation and preventing the formation of a fibrin clot. This is why warfarin is a powerful anticoagulant by inhibiting multiple coagulation factors. That's what I really want you to get. Like memorizing the specific coagulation factors. Yeah, if you're going to pharmacology and medicine, it's good. It might be good preparation for ahead, but yeah, that's a little advanced right now. So this will answer a question we had earlier. So vitamin K is needed to actually form complete coagulation factor or complete and active coagulation factors. So you need it for clotting. But things that warfarin prevents clotting by inhibiting an enzyme that's needed to regenerate vitamin K. And vitamin K also inhibits the effects of warfarin. This is the interesting thing too. Like if you have like a warfarin preventing the activation of these enzymes, well, if you're eating a lot of vitamin, say you want to have a patient who had like who a heart failure patient, and you're trying to prevent them from forming embolisms and thrombuses and thrombi in their circulatory system, to prevent these clots from blocking blood flow to the rest of their body. So you might want to this is why vitamin or warfarin is also called a blood thinner. It's not necessarily making it more watery, but it's making it less prone to clotting. So the thing is that when you have vitamin K, well, even though warfarin is trying its best to prevent vitamin K from being regenerated, what if you're eating a lot of vitamin K? I mean, if you have a lot of vitamin K intake through your diet and you're eating way too much kimchi, this can actually overwhelm the effects of warfarin. So it can actually make this person that you're trying to prevent or lower their chances of forming these clots. It can actually make them more prone to form clots. So the thing is that vitamin K inhibits warfarin, but warfarin also inhibits vitamin K. So it's kind of like, who's going to win now? Is it warfarin or is it vitamin K? Well, it depends on the doses of warfarin and vitamin K you have in your circulatory system. Alright, so then we have our phases of hemostasis. So we have vascular phase, platelet phase, and coagulation phase. And this leads to clot retraction overall. So, clot retraction happens after you form that fibrin clot. So another way I'd like to think of it is for the phases in order and how to describe them, I think of it as 3 P's. So my mnemonic I use is like, first phase is pinch. Why? Because your blood vessels pinch off slightly. So pinch, and then platelets form a plug. So pinch, plug, and then coagulation, what you're doing is forming a fibrin clot, right? So I think of it like a little patch, like a little duct tape patch to finally seal it up. So my mnemonic is pinch, plug, and patch. These are what the phases of hemostasis in order. And if you're including clot retraction as a final, like the little cherry on top, I think of it like pinch, plug, patch, and then pull together. So you're going to pull the borders of that clot together to kind of squeeze it and make it flatter, and also move it out of the way, because what you see here is that this little clot, it has bulk, it has volume. So by flattening it, you kind of help to restore some blood flow by moving this big clot out of the way and kind of making it more compact. Alright, so yeah, so no kimchi when you are on warfarin, and yes, this is why it's very important. If you know a patient is on warfarin, you have to monitor their vitamin K intake. And kimchi, like leafy greens, fermented foods, they're not the only ones that have vitamin K. So this is why you have to kind of make sure, like if you have a patient who's on warfarin, you should actually inform them that, okay, you should avoid these foods or large amounts of these foods, because they can affect the efficiency of your medication and make you more prone to clotting, which we're trying to prevent in the first place. Yep, so this is why nutrition is important, and we still need nutritionists in hospitals, because again, you have to educate your patient. Like, you want them to eat foods that counteract their drugs that are supposed to help treat them and help them get better.